All right. Hi, everybody. Welcome to the Moms at Work speaker series. We have an amazing guest here today to talk about a topic that is near and dear to her heart and the center of her research. So good morning. Want to do a quick introduction?
Yeah, absolutely. My name is Cheyenne Scarlett. I just finished a master's degree at Ryerson University in early childhood studies, and the center of my research was the childbirth experiences of Black mothers in the GTA. So that's what I'm going to be talking about today.
Excellent. And a little bit about, so how have you been doing during all of this? You have young children as well?
I do, yes. I have three kids, two biological children, one stepchild. They are 13, almost 7, and almost 2. So I did the majority of this research with the 2 younger ones at home with me.
Right.
So that was a challenge because they were like 1 and 6, like much younger, right? So that was an adjustment. So I wrote a lot of this at like 2 in the morning.
Yep.
Which was not what I had planned, but I actually think the pandemic helped my research in a few ways because of the interview. So originally when I was dreaming up the study, I was going to do the interviews in person, and I was kind of worried about, having to drive different places to meet people because it was going to be the whole GTA. But then it ended up being that I did everything online. So I was able to do like 4 or 5 in one day. A lot of them were done during nap time. I'd email the moms like, when's your nap time? My nap time's this time, right? So that was actually a plus that a lot of people were home. But I do also think about who might not have participated because they were at home and, had other things going on.
So you're at Ryerson and they ask you what your research topic is, and you said this. So what started this amazing research project?
Yeah, so I also have a bachelor's degree in child development and a diploma in early childhood studies. So I approached birth from the perspective of children and how the birth experience and method of birth influences children long term. So one of the things that I really like to focus on is the birth experience and how birth trauma can influence the attachment relationship. So when you do research, you have to say, this is what I've read, and this is why I want to do this study. So I was wanting to do a follow-up with, if you had a traumatic birth, if you had a difficult birth, how did that influence your parenting? But I didn't have, and I wanted it to be very small because I didn't have that much time. And I thought, okay, let me pick Black parents. But then I realized that there is no race data on anything here. So I wasn't able to say.
Hold on, none?
Okay, someone has done an estimate on premature birth rates, white compared to Black, in relation to the US stats, and they've concluded that they're probably very similar, but we don't collect data. So I always like to start a paper with a stat and saying, I wanted to say, this is how many babies were born to Black parents in whatever year, and I could not find that number. Like I couldn't even get that. We don't know what the maternal mortality rate is, morbidity rate, infant mortality rates. We just know for Canada as a whole. Some data has been disaggregated by Indigenous and non-Indigenous, which is not helpful at all, really. So I wasn't able to find a study that said, this is what the birth experiences are of Black people. So I wasn't able to springboard off of that. So I said, okay, I guess I have to do that study. So that's how I arrived at that.
No one's done it before. It's your chance to do it.
Yes, there was a small study of, I think, 10 people, but they were all African immigrants and they were living in the East Coast. So that's not very contextual to Black people who were born here, whose parents were born here, and living in Toronto, which is much more diverse than the East Coast.
So gone through it, and you did the study during nap time, around other people's schedules. And what has come from that study? For you personally, for the study, what has come from that?
Yeah. So when I started the study, I thought it was just going to be, a requirement for my degree. If I got a publication out of it, great. But it has like really exploded, and
Right.
I feel really grateful. And like a lot of people have contacted me to talk about it. They're like, "This is great. We don't have anything else to go off of."
Right.
And for me personally, it has sort of pushed me into the direction of starting my own business, just because the jobs that I want to do and helping people prepare for birth to prevent trauma is doesn't exist. I can't Google that job.
Right.
Um, so it's meant a lot for me personally. And I know it's meant a lot for the people who participated in the study. A lot of the women were like, I had this horrible thing happened to me and I don't have anybody to tell. After they told me their story, they felt like a lot of relief.
Right.
So and out of that, and knowing that there needs to be a platform for people to talk about their births, I started an Instagram page called Black Births of Toronto, where people can write in and talk about just their reproductive stories, lactation, reproduction, birth, infertility, anything. Just like a place to talk about these things, because it feels like, a lot of people participated in the study just so that they could talk about it because they
Right.
don't have anywhere else to do it.
And from the study, what was the general, were there any trends? Were you seeing people saying the same things over and over? What was sort of especially in Toronto, because it's so GTA specific, a lot of them would be using the same centers or going to the same thing. So what was the kind of overall um, feel of it?
Yeah. So, in order to protect the confidentiality of people, I didn't on record which hospitals they gave birth at. But when they spoke about it, I was like, oh, really? I've heard a similar story from that place. So it's clear that it's not just a one-off,
Okay.
that there's reasons that this is happening. So I interviewed 30 women, and 70% reported a negative racial experience. And of the 30% who did not, um, most of them had experienced racism with a previous birth, or just with the healthcare system in general. And then they took steps to make sure that they were not in that same situation, got a new care provider, decided to have a home birth, things like that.
And
So,
yeah, and so was there, in terms of experiences, that cuts across all things. So home birth, at a hospital, midwife clinic, was there any sort of correlation between like the type, like that people switched afterwards because like you just said, so are most people, actually the better question is, were most of the people you talked to, was this like their first birth, second birth, and did that make a difference?
yeah, so most people did talk about their first baby.
Yeah.
Um, and so how many went? Yeah, 12 with their first, 14 with their second, 4 with their third.
Okay.
So 10 people had midwives, 20 people had an OB.
Hmm.
Um, Unfortunately, like people with midwives still did experience racism, which I was like super
Yeah.
disappointed, because I'm always like, midwives are the best, they're awesome, and of course they still are, but I was really disappointed to see that.
Yeah.
So it's really important to remind you that, not you, everybody,
Yeah.
that you know, trauma that happens to us because of birth is not our own fault, even though we can do things to avoid it. Even if it still happens, it's not the fault of the person. It is the fault of the person inflicting the trauma, right?
And
Um,
I think that's such an important message, because I think for everybody, when they go through that, people feel personally
yeah,
responsible, like that said.
yeah,
So I can understand why talking about that would help relieve some of that, anxiety.
yeah.
So what's next? Done this study, it went in places you did not expect it to. You have an amazing Instagram account, too, right?
Yeah.
And maybe talk a little bit about what you're going to be doing now, your website, that sort of work, what this has led you to. More school?
Yeah.
Yeah.
Yeah. I definitely want to get a PhD. That's something I definitely want to do. I think I want to get a PhD in policy so that I can take a closer look at some of these policies that exist that people believe are rooted in fact and in science when they're not. And just understanding better why people like healthcare providers believe what they do, because I don't think that doctors and nurses and midwives go to work every day saying, I'm going to traumatize some people. I don't think that they have that malicious intent, but it's clear that it's happening anyway. So I
Right.
think we really need to find out why that's happening and how to stop it. Um, but yeah, so in the meantime, I'm going to be offering birth planning services so that,
Okay.
we can go through the whole list of what your options are. And, this is what you can expect. And this is, how you can advocate for yourself. And this is the team that you need to help support you in that. And then simultaneously taking, what I know and what I have learned from working with people
Mhm.
back to the healthcare providers to say, when you do this is what's happening to your patients. And I think a lot of people believe that birth is just that day and that, after it happens, it doesn't matter. And, you know, a healthy baby is all that matters. And that is not true at all. Um, Especially when you consider child development and attachment theory. If if you have traumatized a parent so deeply that they now have PTSD, how can they really emotionally care for their child and themselves and help their emotional development
Right.
be on track, right?
So I don't know if this is something that we're going to, how COVID is impacting the birth process, because we've heard a lot about, at the beginning, people weren't allowed to have anybody in with them. And that, and I can say like with mine, like I just had my son in the hospital, my husband couldn't be there, right? That adds a whole other level of trauma about these support systems that we really birthing mothers need. And it's making it hard. So have you heard any, even like stories about people and how this has changed it for them? Can you talk a bit
Yeah,
about that?
yeah. So in my study specifically, there was 4 people who gave birth around the pandemic.
Okay.
Um, One of them, it was right at the beginning and she was fine, but she sort of like felt bad for the people who didn't get to
Right.
have their whole system with them. Um, One parent, one mother, she wanted to have give birth in the birth center because she feels like a hospital is like a dirty place in general, and then with COVID added, but unfortunately she couldn't. She had to transfer to the hospital. Another one, she had an emergency C-section. So that was really hard because her husband couldn't be in the operation
Right.
room with her. And then after that, when their baby needed to go to the NICU, he wasn't allowed to go see the baby either because he wasn't allowed to leave the room. And they forced them to choose one parent to only visit the baby in the NICU. So he couldn't go see his own child for 4 days. Like he saw him immediately after the birth and then couldn't go again. So, I wasn't able to get into what that
Yeah.
means
Right.
for the father and his relationship with his child or their marriage, but like you can just imagine how
Yeah.
difficult that is. Um, and then another mom, she loved it. She said it was great that none of the
Right.
nurses wanted to come into her room, and that golden hour was truly undisturbed. And they did the newborn assessments, like all the weighing and stuff, much later than they usually would. So she really enjoyed that. So it's really back and forth. But we keep hearing these awful stories in the news. Even a hospital in, I believe it was in Ottawa, they created a policy that we got shut down very quickly by bombarding the head of the department with emails. But they wanted to force everybody to have an epidural.
What?
Exactly. They
What?
said if you're going to give birth here, you need to have an epidural. And if you don't want the medication, fine, but you must get the needle in your spine just in case you have to have a C-section. And you're like, no, that's a
No.
complete violation of human rights. And, obviously that policy was created for ease of the surgeon who would do the C-section.
Right.
So first of all, why are you assuming that so many births are going to end in C-section? Second of all, like, why is your ease more important than another person's spinal cord? Like, it's
Right.
not. it's not nothing, right? Um, it's yeah. So just things like that. That why was that policy allowed to be created? How can you be in charge of a whole department and believe that that's okay? You know, like what else are you implementing?
That's a that is a strange and horrifying policy as someone who has birthed 3 children. Um, that's my
Yeah,
spine, right?
yeah,
Like, you don't get to make decisions about my spine. That's not okay. Uh,
exactly.
wow. And so maybe talking a bit about the importance of this sort of birth plan. So the piece that you're working with people. Um, so what does that process look like? How do you assist people? Do you meet with them? Do you guys like, how does that work? Do you include other people, partners?
Yeah.
How does that work?
Yeah, so it's virtual right
Yeah.
now, of course. So I would send them my birth plan template ahead of time. They could take a look and think about the questions that they might want to ask. And then we would go through it together and then they would have the opportunity to say, you know, what's this thing here? Like what are the benefits and limitations of that? Because when you're doing a birth plan and you look it up, there's like 6, 7 pages of things and you're like, well, what is this? And is this good or is this bad? And then something else I noticed is that a lot of them are quite biased. Like they'll say, I want dot 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 and then the list. And then or they'll say, I don't want dot dot dot. And then when it says I don't want, you're like, well, should I not want that too? And it might not give you the opportunity to actually look up what is good, what is bad. And I think there's a lot of belief that you have to do whatever the hospital says or whatever your healthcare provider says. Um, and that's just not true. And creating a birth plan is not so that you can be like, this is what we're doing, and I don't care what you have to say
Right.
to your healthcare provider. It's a tool for you to learn about your options, to discuss with your partner, with whoever else is going to support you, with your doula. This is what I want, and this is what I would like to happen. And if that can't happen, I would like, whatever
Step.
else to happen. Because when you're in labor, you're not going to be there Googling, should I do this or should I do
Right.
that, right? So you need an idea of what's to come. And I think it's really important also to make like contingency plans for what you will do if,
If.
you know, like if you have a C-section, which of course, the risk is low, but if you do and you weren't expecting it, that can be really, really difficult to process. And then, you get home and you weren't prepared to have had
Right.
surgery and you need extra help, you need extra support. So you need to have those plans in place to sort of buffer the things that could happen to you.
And so is that something you work? So that's been the sort of hardest thing because I read your Instagram. I read your Instagram thing. Is that, and I've heard people say they're like, but I can't have people in my house. I'm protecting against my parents. They can't come to see the baby. So what sort of recommendations can you help with in terms of like where to find support?
Mhm.
Especially in the GTA right now and with COVID, it's like what kind of things, like, thinking outside the box, um, what kinds of things can help if you've had a child and you need support afterwards?
Yeah, yeah. So I think number one, definitely like having like a list of
Yep.
phone numbers on hand, lactation consultants, things like that. Planning for meals ahead is really good. Someone can just drop that off on your porch and you don't have to have face-to-face contact. Making freezer meals ahead of time. If you have a pet, asking someone to come by and walk your dog, you can do that. There are quite a few doulas who are doing postpartum support, and they'll wear a mask and
Okay.
and try and social distance as much as possible. But definitely, like if you do have a partner, sitting down with them and saying, this is what needs to be done, this is what I would like to do. And then just like making sure that your only job is to take care of your baby and then like yourself as well. Um,
And I
yeah,
think
so
that's,
it's really challenging right
yeah.
now,
And I think even though, I'm like, we're both on our third kids, I think when I think of birth plan, even now until you were sort of saying those things, I'm like, people think birth plan is like up until baby comes out and then there's like nothing, you know what I mean? Then I
Mm,
didn't even, after I was just focused on like what this part looks like. I didn't
yeah,
think about this part. And when in fact, it's like the moment this is over, then I went, oh no, I didn't actually
yeah,
think about these other than putting meals in the freezer. but I didn't even know what a lactation consultant was. So I think,
yes, many people don't.
or that they could do something to help me, right? That wasn't even across my mind, but I think that's something people need to know, is that working with someone like you, like that plan can go all the way across so that you can have a voice, right, through the whole process. So it's an amazing service. So why don't you talk to us a little bit about your social, about your website, things that, people, because it's great information, even if people don't, have the resources to do that, it's great information.
Yeah, so in addition to like actually buying the service itself, if you are in need of that, you can submit. There's a form to request for either reduced cost service or free service. So I can like work with you and help you, because I know that this is like, it's really important. I'm not doing this to make money. I'm doing it to support people and, also support my livelihood at the same time. So also on the website, there's blog posts. You can read a little bit more about things. There's a couple quizzes to get an idea of which healthcare provider might be best for you if you haven't chosen one. And if you have and you don't like them, you can get a new one.
That's very important. I don't think people know that, right?
No.
If it's not working for you.
I think the challenge, a lot of people get their information from American sources. And there's a big problem with that, especially because I know in the US, if you have, certain insurance companies, they say after X amount of weeks, you cannot get a new doctor. And then if you want a new one, then you're paying out of pocket. And that is not the case in Canada. They might charge you a fee for transferring your documents to your new healthcare provider, but that is it. So even if you're in labor and you don't like who you're dealing with, you're allowed to change. You can do whatever you like. So that's something really important to think about too. Yeah. And then I have another quiz that talks about which birth location might be best for you. Because I think there's like a big misconception of home births and big birth center and hospital, and like which is safer and what's better. So of course it's not medical advice, but it just asks little questions about, do you feel safe in the hospital? Yes or no? Because if you don't feel safe in the hospital, that is really going to hinder your labor. Right. So just things like that. And yeah, like just to join the community and, network with other people who are pregnant or thinking about getting pregnant or had babies recently.
And so your Instagram handles are?
So mine is at Mother of Scarletts, because that's my last name, Scarlett. And then Black Births of Toronto. And then the website is babyplanner.ca.
Planner.ca. Perfect. So now everybody knows where they can find you. Everybody knows where they can send people who need you to your services, because I think we've hit on a few really important things here, people, is that, the birth plan does not just stop when you have a baby, that you have a lot of resources to help you become more empowered in that. I know a lot of people in my group have had one baby or two babies. That doesn't mean that you can't have a different experience with your next baby. And now we know how important it is. So, if you have someone who's having their first baby or second baby or third baby, that these resources are out there, that these resources are important, and that it's important to have, dare I say, it's like an advocate on your side to help you understand those processes. And I think people are going to look and say, wait, I could change my healthcare practitioner. Wait, what? Because I think that people, I didn't know that. I didn't know that. I thought, oh, I'm so lucky to have this person, and mine was fine. But I've heard some of the same stories you have where it was not a relationship where they felt heard. And that's sort of key to your studies, is that how important it is. So I will put links to websites, Instagrams. You're going to have the opportunity to do some quizzes and as well as contact information. So if anybody needs to get in touch with you, I just want to say a big thank you for being here and for sharing with our whole community. Really important work that you're doing. And I'm going to continue to just follow you on Instagram and see what you're doing next.
Yeah, thank you so much for having me on and giving me the opportunity to talk about it.
Great. Can't wait to see what you do next.
Amazing. Thank you so much.
Thanks.